Is a Muslim nurse allowed to treat the opposite gender?
Male nurse take care of a male patient, or vice versa? Can a male nurse take care of a female patient? একজন পুরুষ নার্সকে একজন মহিলা রোগীকে বা একজন মহিলা নার্সকে একজন পুরুষ রোগীকে সেবা দিতে পারেন?
In principle, very quickly, yes, পারবেন। তবে নরমাল যদি সিচুয়েশন থাকে যে এনাফ মেল অ্যাভেলেবল, তাহলে let the male treating male, enough female available, let the female treating the female.
Otherwise,
when it is shortage or an emergency, yes, they must do it. The best example, one of the female companion of Rasulullah sallallahu alaihi wasallam, I have the list of about 9 or 10 female companion of Rasulullah sallallahu alaihi wasallam. They used to treat patient, even male patient. And one of the famous is Rufaida bint Sa'ad al-Aslamiyya al-Ansariya. And Sa'ad bin Mu'az, one of the very, very big leader of Ansar, when he was sick, then she was serving Sa'ad ibn Mu'az. That means Rufaida is serving Sa'ad bin Mu'az.
I'm going to take pause. Before that, let me clarify. You are saying even in the perfect time,
yes,
the female nurses taking care of male patients.
Yes, okay. And she used to be the first Muslim nurse.
And she used to be the first Muslim. What is her name?
Rufaida bint Sa'ad. Rufaida, daughter of Sa'ad, Ansariya from the tribe of Ansar from Medina.
Okay.
Her name is Rufaida. I have another name like Ammara Nusayba bint Ka'b al-Ansariya, Sulaim, mother of Anas, then Salama, the wife of Rasulullah sallallahu alaihi wasallam, then Umayma bint Qais, Umayma daughter of Qais, al-Ghifariya, and I have all this.
Okay, thank you for mentioning all these names.
The duties of a nurse, is it all about personal care?
All about cleaning vomit, blood and body fluids?
No, I mean, that's one aspect of nursing. But actually, when you're nursing your patient, it's about assessment. And it's using your skills through speaking to your patient, identifying social and psychological needs of those patients. And it's working with other healthcare professionals, as in the doctors, the physiotherapists, the pharmacists, and making sure patients understand their occupational condition and understand the care that they're receiving. I mean, one of those aspects is about patients understanding their medication, so that actually they're taking their medication to actually improve their health outcome. And again, I'm sure as anyone who's been a patient, the doctor sees the patient, and then the patient will say to the nurse, what did that mean? And what is that blood test for? And is that observation normal? So there's significant skills you get during your 3-year training to make you independent healthcare practitioners.
Sister Naha's experience as a sister and a practicing Muslim.
Made you to come to nursing, and are you enjoying it?
Thank you for inviting me, first of all. I'm really happy to be here because I've been always supporting the recruitment of Muslim nurses. Initially, when I started, before my career plan, I wanted to be a teacher or a nurse. So I did start teaching for a short while, and then realized that it wasn't meeting I wasn't fulfilled with the care that my compassion desires that I had for caring for the sick and the elderly, and it was not meeting it. So therefore I went into nursing and discovered that it was just an amazing experience, that I just felt absolutely satisfied.
Have you felt a religious obligation, as Imam Madani has mentioned?
Absolutely. I mean, I'm very pleased that Imam Madani has said this was the whole reason why I went into nursing.
Okay.
Thank you.
Okay. Have you received enough adequate support and training, or any difficulties?
I've actually, alhamdulillah, with City University, because that's where I graduated from, and the Barts, the London Trust where I work. When I was training, I took actually a 2-year career break to start a family, and they actually allowed me to do that.
So they were very supportive.
Absolutely.
Could you tell me, do you wear the same dress?
Yes, I do.
In your profession, and
yes, I do.
It's not a problem?
It's not a problem at all.
Okay.
Yes.
Okay. As I know that you won't be here in the second segment. You couldn't afford me enough time. What would be your message to the community?
My message to the community would be, I would really emphasize that nursing is a very, very satisfying and rewarding job. This is not just a job. This is a job that you will feel satisfied for the world and for the hereafter. As a Muslim nurse, I feel satisfied that I'm caring for somebody. I'm making a difference in people's lives. I look after patients with breast cancer diagnosis, and from initial treatment plan to the end of care with the dying, I'm there for them. And I think the community actually wholeheartedly really respect me for that. And they are really, when they come, even non-Muslims, they'll come and they'll say to me, "Oh, I love your dress." You know, so it's just like you're being modest. I'm not going out there to just look after any random person. I'm going there to look after the sick.
Thank you for your comments.
Nursing in Islam, Imam Abdul Rahman Madani.
Community also, can I get a promise from you that if you could kindly mention it in your sermon any time?
Inshallah, I'll be doing that, inshallah. Normally
you.
I do it,
Okay.
and I'll be doing that again, reminding the whole community in my Friday sermon, inshallah.
Thank
And
you.
Islam Essentials as well, we do that.
Thank you.
And my message to my young brothers and sisters, this nursing profession is something very, very important for our community. As I said, it's a collective responsibility. It must, a group of people, male or female, come out, and they will be professional caring for sick people, and you must come out. Otherwise, all of us will be responsible for this. It's your duty. Please get out. And some people, some brothers, some sisters, they have to come out and getting this nursing career, inshallah. That's my clear message to the whole community, inshallah.
Nursing, shift work and work-life balance.
My next question to Annie Levington: is nursing a 9-to-5 job?
No, not completely. We have actually shift patterns which enable a 24-hour delivery of patient care, and often we use the term 24/7, which indicates patient care is 24 hours a day, 7 days a week. But we have a variety of shifts called early, late or nights.
Okay.
And staff have a variety of those shifts. But we also have at Barts in London a working friendly policy,
Right.
which enables the work-life balance to be able to be completed.
Nursing, career progression opportunities.
If you don't mind.
27 years.
27 years.
27
And you are still enjoying it.
I am.
Okay.
And I've gone from clinical to the community and now towards education.
Okay.
So wide opportunities in nursing.
Okay. I have some colleagues who used to work as a nurse. Now they're sort of managing different projects. And is it a possibility that at some stage, if you want to move into a different profession, you can still do that?
Oh, definitely. I mean, the pathway in nursing is so vast and wide, and you actually will take on forward academic study. And part of that academic study is sometimes looking at various project work, looking at developments in health service,
Sure.
and if you wanted to develop your career, to go into community nursing, which is further academic study. So to stay in the clinical field, there are so many options that you
Okay.
can
Will you
do.
mention about developing?
The skills required to become a nurse.
What skills and qualifications are required to make a good nurse?
Well, there's a whole variety of skills and qualifications that you actually need to make a good nurse. As many of you probably already know, nursing is becoming all graduate, and from 2013, and a number of universities are moving over to all graduate before then. So the entry into nursing, really, from now on, is going to be the equivalent. Is going to be A-level entry or the equivalent. And I think that that's a recognition of the fact that nursing is increasingly dealing with very complex medical technologies, with very complex drug regimes, and you do need the skills and the knowledge to actually be able to manage those technologies. So
Right,
I think
okay.
that that's very
So
important.
nursing is not a job for job logs. It is a very skilled,
Absolutely.
highly educated job.